It's preliminary online project on basic health. In this video presentation, I'm going to demonstrate both vital signs and what are vital signs. Vital signs are basic and key indicators of one's body function. It gives the brief objective condition of the physical condition of a patient. So, vital signs has to do with some key elements like thermometer, which is this is a digital thermometer. Then this is a mercury glass thermometer. Then here with me you can see this is a digital VP apparatus. The device is attached with a cuff, which is the cuff is water tied on the arm of the patient when the procedure commences. So here you can see this is a manometer. This is a manual procedure. And here is the stethoscope, which can only be used with the manual procedure. So before we commence, I have to measure my height and height. If I will be which is very important. If there is no alcohol based balance, okay, having done that, I have to quickly go into the procedure. So using the digital thermometer, I have to read it. So, and this can only be used at the axilla. So I want to insert it at the axilla. Then I switch it on. This will stay for about 30 seconds. As that is released, I have to prepare to take notes of, prepare for the CBP measure blood pressure. Okay, you have to document the temperature of the patient. As every point in time, you have to make sure that each of the procedure is well documented. So now we can just check. It's already. So this cuff is situated at the brachial artery. I'll set up the device. So what is the blood pressure reading I want to take now. So having situated the cuff, so I have to mount the device. This device takes note of the pulse and as well the blood pressure. Yeah, the device takes note of the systolic and the diastolic reading. So the systolic is the upper reading, while the diastolic is the lower at the pressure state. That is the systolic. One systolic pressure of the blood. That is pressure stop. That is the diastolic. So I'm only the frequency.
Attention please. The kids toilet is active call at port level. Thank you. Your blood pressure is systolic pressure.
Okay.
98.
The device have displayed the
Diastolic pressure.
blood pressure level
48.
and as well the pulse rate, which has to be documented. The pulse rates, they're all nice. So you have to remove the cough. That's the next we are going to check his respiratory rate. In doing this, we want to use this hand as standard. So you have to check the radial artery. This has to be done for about 20 seconds. The patient's respiratory rate is normal. To 100 per breath per minute. So that is the normal range and it's at the normal range. When taking respiratory rate, you don't need to notify the patient. Ideally, while taking the pulse, like if the pulse is making manually, I can even take pulse rate and respiratory rate at the same time. But in a situation whereby the patient is lying on the bed, you can determine that either assessing via visual examination, checking the respiratory rate at the rate at which the patient breathes. You can do the abdomen in the chest, the rate at which the heart beats, the abdomen rise and fall. So that is another way of checking the respiratory rate manually. So finally, we are going to use a objective examination to ascertain the pain level. Having anything. This examination of pain level is numerical examination, which has to go 0 to 10 numerical examination. The 0 means the patient is having no pain. The 8 is that anyone that patient is having pain between 34 to 10. It means the patient have to say it, and that has to be taken note of. Because all these variations can affect the temperature, can affect the BP, can affect the patients having pain. So it's very, very important. In such situation, even the pain level is determined first before carrying out other examination. Then in a situation whereby you know that the patient don't have any of such case, the order of vital sign examination, like taking the temperature, taking the BP, taking the respiratory rate, can go in that order. So that is the end of this vital sign